Hello, 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 listeners, and welcome back to another episode of the Cult Vault podcast. Today, I am joined by another expert, and I'm so delighted to introduce Dr. Warren Hern to the podcast. Hello, Dr. Hern.
Good morning, Casey. Thank you from across the ocean, across the pond, from one of the colonies, and I appreciate very much your invitation to be with you.
It's a very timely conversation given the way that the vote landed the other day over in the States. And I'm sure that we will talk about that as it is tied in with what you focus on in your profession. So with that being said, would you like to introduce yourself to the listeners?
Yeah, I'm Dr. Warren Hern. I'm director of the Boulder Abortion Clinic in Boulder, Colorado, which is my specialty medical practice specializing in outpatient abortion services since 1975. I actually did this work before that in another clinic that I helped open. And I am the author of a new book called Abortion in the Age of Unreason, a doctor's account of caring for women before and after Roe versus Wade. So it was just published a couple months ago, and it has a lot of information that's pertinent to the election itself in terms of how we got to this point.
Having this as your main focus in your medical career, how did you find yourself working, at the forefront of helping women access these procedures?
Well, whether I'm at the forefront or the back front, I don't know. It's going to be for somebody else to say. I opened my practice in January 22nd, 1975, after performing abortions for over a year at the first private nonprofit outpatient abortion clinic in Colorado, where I was the founding medical director. And I was helped organize that clinic at the request of other people and performed all the abortions there. But at the end of that year, it was clear to me that the most important thing to me I could do in medicine was perform abortions. And so, since I had left the other clinic, decided to open my private practice, which I did in January of 1975. So I've been doing that all that time. And so, I think that at no time did I ever think that I was any leader in this field or in the forefront or anything like that. I'm just a physician practicing medicine and helping women, and we've taken care of tens of thousands of women in my office, and we specialize particularly in doing late abortions, an advanced stage of pregnancy, and many of my patients are women who have desired pregnancy that have been complicated by serious catastrophic fetal abnormality.
So when you talk about late abortions, what kind of lateness are you describing when you use that word?
Well, there's no clear definition, but generally it's considered after about 20 weeks of pregnancy, and fewer than 1% of all abortions performed at that stage or later. And so I really have no official upper limit, although I really will not do procedures past about 32 or 33 weeks unless some specific indication, and also it becomes more complicated at that point. It's more complicated at any point in pregnancy, but it's especially after 20 weeks. And I've devised a number of instruments, procedures, and protocols for doing abortion safely at that stage. And so I've been seeing patients for a long time for that kind of need. And so it requires a much more complicated operation with more staff and highly trained and experienced professional people, doctors, nurses, counselors, and everybody. So that's what we do.
You've seen the shift and changes in women's ability to access medical treatment, abortions, terminations, follow-up appointments. How have you seen that change over time since your opening in 1975?
Well, in 1975, it was a relatively new situation, and we were learning how to do this properly and across the country, and we talking with each other at conferences. But we didn't feel under any terrible legal restriction, and there was a political effort, obviously by the anti-abortion people to restrict what we're doing, but we had the support of the public, and we worked without political interference to a large degree, although there were some places where the resistance began to develop. What has happened more recently, and it's hard to pick a certain point, because the Republicans have used the abortion issue now for 50 years to get power, has been very effective for them. They've elected 4 presidents, now 5, with counting the new election of Trump, re-election, and they've taken control of the legislatures and state and national level using that issue. So it's been a very effective tool to power for them. And what that has meant increasingly is that women have to travel long distances and later in pregnancy than they would have had to do before to get the abortions. And at one point was when the Texas legislature was to be 8, 1920 and 2022, it was signed to the governor, and the governor is very anti-abortion. And so that meant that the many clinics in Texas closed, which made it very hard for clinics in surrounding states. And then the Dobbs decision made this catastrophically bad situation, 22. And so that now almost a half of the states in the country have either made abortion completely illegal or made it so restricted it's effectively illegal. And there are many other states that have very cumbersome restrictions. And so this is a terrible situation for women. And so it's not only difficult for women to get to us to have the abortions, but it's very difficult to find doctors who will help them afterwards, either to see them for routine follow-up exam or treatment for complications. But this has affected women who have desired pregnancies, that they're not seeking an abortion. They have a complication where known complication of pregnancy, and they can't get help because the doctor's afraid to go to prison.
Oh my goodness, yeah. I hadn't even considered that even in states where people are, it's illegal to have an abortion, but you go to a hospital and you're pregnant with a complication, you just kind of get left. Does that happen?
Yes, that's exactly what happens, and the women died.
Oh my goodness.
That is the intended effect of the anti-abortion regulations. It's cruel, it's stupid, it's medieval, it's unacceptable in a civilized society, which increasingly we are not in the United States.
What are some of the most difficult cases you've had come to you from outside of Boulder, Colorado?
Well, every week we have patients that have very serious problems with pregnancy and complications to the point that other people will not see them every week.
Absolutely terrifying. It's unfathomable. And I've seen a lot of the social media fallout post-election results in terms of staunch Trump supporters celebrating the results and making jokes about how, we're about to turn into Gilead and The Handmaid's Tale. But your conversation makes it feel like, it's not like something that that could never happen. This is kind of a macro level. We're talking about kind of the larger kind of political leadership in play and the implications for America as a society and a ripple effect on the world, because it will have a ripple effect on the rest of the world. You, as an individual, have faced significant threats and violence in your career. I was really surprised when I received the email from your kind of agent who connected us together about some of the threats and violence that you faced, because I was in the middle of watching Grey's Anatomy, and there was an episode in season 19, episode 11, called Training Day. And it centered around one of the characters that's kind of in and out of the show throughout the seasons, called Addison Montgomery. And she has decided to focus her medical career on conducting abortions on women who can't access them in their own states. And there is a scenario in this episode where she is victim to a hit and run. Then I was reading the email from your agent, and this is very similar to some of the experiences that you've had on the back end of the work that you do. That is extraordinarily scary.
It's a big problem.
Why do you think Colorado is standing almost independently from the rest of the states in the way that you kind of think about this subject and the way that you operate differently as a state for abortion rights?
But in the first place, Colorado has had a pro-choice condition, a characteristic for a long time. In 1967, Colorado was the first state in the United States to make abortion legal and have an abortion reform law. That was followed by a bunch of other states. And that was 1967. And in 1973, with the Roe versus Wade decision, the same legislators who had sponsored the abortion reform law in 67 helped to remove the restrictions that they had put on in order to get the abortion reform law passed. And so we've had basically, for the most part, since that time, Democratic governors and legislators who have supported abortion rights. And that has not been uniformly true across the time, but has been mainly true. And right now, we have a strong pro-choice state government. We have a strong pro-choice organization that brought about this ballot initiative to install this conscious amendment, and they succeeded. And I'm sending them my congratulations. So that was very significant. And I think that we're going forward. Of course, there is no permanent success. We have to be vigilant. We have to maintain the same pro-choice government we've had now and we have now in order to maintain that. And I think that that's the political challenge. And it turns out that many people, even though they may disagree on many other issues, agree that women should be able to have safe abortions in Colorado. So that's where we are right now, anyway.
You are a doctor that is 85?
Amazing.
Is that right? 86. Right. So that's astonishing to me. Congratulations on such an incredible career. Are you still practicing because you're so vital to this fight, or is it because you are just want to carry on with your work?
Well, that's an excellent question. We deal with that every day. I think that, first of all, I do love my work. I love taking care of patients, but I have other physicians on my staff who are seeing most of the patients, and I'm turning it, to the extent possible, all of the patient care over to the other doctors. And they're highly experienced and highly skilled. I've trained them, and they come to me already experienced. And so I'm including other physicians, and the objective is to replace myself completely, both in terms of medical care and the administration part. I have a lot of other things to do. I'm not going to quit. I mean, I am going to stay working, but I want to change my schedule and have the other physicians see all the patients. So then I've done this for over 50 years, and I'm pleased with my career. And my problem is that if I'm in the operating room, I can't do anything else. And that's a problem because I have many other things to do that I must do, and I can't do them when I'm in the operating room. So being able to talk with you right now is because I have another doctor seeing the patients today. Okay. Otherwise, I couldn't.
And I imagine that you did not want to enter retirement with the country that you live in being in the condition that it's in. How does that feel, having a 50-year career as an abortion specialist and now kind of like thinking I might fully retire in the next few years, and this is kind of the state that we're in upon my retirement? That must be heartbreaking.
Well, it's very discouraging. I mean, I can't affect very much anyway what the American public decides to do. I mean, I have my book out, which is as you may have known, as the Abortion in the Age of Unreason. And I don't know whether it's backwards on the screen for you or not, but anyway, it was published by Routledge, which is a major press in England, and they did a fine job of it. And I'm talking about this exact problem: the fact that the Republican Party, the Christians, used the abortion issue to get complete power, and they have it now. And American people voted for that. I mean, if American people vote for fascism, that's the end of the road. I mean, I think that you forget about protecting the environment, forget about civil rights and human rights and women's rights, and I think that it sets us back way more than 100 years. And there are many things happening in the United States right now that are very similar to what's happening in Germany in the early 30s. So one of the ways to understand the new Trump administration to read a book called January 1933, Hitler's 30 Days to Power. Another book on tyranny by Professor Snyder in Yale. And so we're on a path to destruction now, and it's hard for me to see how that can change.
When you are working with people that have come from states where abortions are illegal, are you seeing children or young adults, or is it primarily adults that are coming to you to access procedures?
Well, we see very young patients who are 10, 11, 12 years, 13 years old. They're children. And many of them have been the victims of rape and incest by a family member, and they don't hardly understand what's going on. They're certainly not prepared to be a parent, and it's a tragic situation because they're at very, very high risk of dying and having a baby at that age. The maternal mortality rate is at the highest for very young adolescents.
Well, there's absolutely no way that can be justified by any.
Well, there's no justification for any law restricting abortion. Period. Pregnancy is not a benign condition. It's a dangerous medical condition that has a death rate. We know what the death rate is. It's called the maternal mortality ratio. No matter whether the woman wants to be pregnant or not, or even if she has the best medical care, there's a death rate. And under those circumstances, the treatment for pregnancy is abortion unless the woman wants to have a baby. Otherwise, she's being treated as livestock. That's her purpose, is to have babies. Well, when Pat Schroeder was elected to the U.S. House of Representatives in 1972, she was asked, how can you be a mother and a member of Congress? She said, well, I have a brain and a uterus, and I use both.
Yeah, that's the common sense to me, but I feel it's really funny that she had to say that out loud.
Yeah, but she didn't say it out loud, and she's incredibly brilliant, funny person, and you're a friend of mine. But I think that this message is not sinking in to the American public. So, but that they're stuck in a cult. They're stuck in two cults. They're stuck in the cult of Christianity, and they're stuck in the cult of Donald Trump, which means you don't have to think. All you have to do is follow the leader.
Well, this is exactly the parallels between the work that I typically do and our conversation today. I speak with survivors of cults and destructive groups, and so many times there have been women that have talked about being born and raised in cults that they cannot leave, where they've never experienced a different reality, where they are told that the outside or secular world is so evil and dangerous, and they're also then restricted from medical health care. They are reproductively coerced and controlled. And then they have no access to trained midwives. They're just expected to go through a pregnancy and go through a birth with the support of other cult members, which we know is not adequate enough. And sometimes, as you just said, even with the best medical care, that is still not enough to save a mother's life, whether that is through pregnancy or through labor. And that is without any complications post-labor with the mother or the baby or babies. Sometimes there are cults that are found to have mass burial grounds where they just bury infants because they don't access any hospitals or they don't invite doctors to come to their communes or their homesteads. It's absolutely wild out there. But what you've described about how reproductive rights are criminalized in certain states sounds exactly the same as what some of these women are describing in communes that they've lived in churches that they've accessed, in homes that they've been raised in, but just on a countrywide level. And that is absolutely terrifying.
That's where we're heading. And then the Republicans and the Christians want this to be a national ban on abortion and the ban on women's health care. The doctors will not touch women now because they're terrified of going to prison. In Idaho, at least one or two hospitals have completely shut down, and half of the doctors who do high-risk obstetrics have left the state because they can't practice medicine there. So if you want to have a baby in Idaho, good luck, you have to better move.
I want to know what you think we should be talking about with healthcare providers in states where abortions are outlawed and criminalized, and also what conversations we should be having with up-and-coming healthcare providers that are interested in working in women's medical care specifically.
Well, I don't know about the term providers. I'm not a provider, okay? I don't provide anything except money to the bank. I'm a physician, so I don't provide abortions. I perform abortions. So I did not go to provider school. I went to medical school so I could be a physician. That's what I am. I'm not a provider. Okay, and I have medical students that come to visit, and I have young physicians of all kinds, and I encourage them to do this, and I applaud their interest. I think that it become increasingly difficult to do anything about this. If they live in a state where abortion is illegal, such as Texas, I recommend that they move. I think all physicians should leave all the states where abortion are illegal. If people, that because it's impossible, because 50%, more than 50% of the population are women, and if it's illegal to take care of them, how you can't practice medicine. And I mean, it is barbaric to deprive 50% of the human population of the health care they need to have. It's cruel, stupid, it's medieval, it's barbaric, it's uncivilized, it's inexcusable. But that's what the Christians and the Republicans are doing. And the American people voted for that. That is one of the things that's so appalling. Americans are not paying any attention between their vote and the policy result. And so it's somehow magic. And they used it as a way of expressing their anger about things that nobody can control. And here we have the presidency of Joe Biden, who was a superb president, has been a superb president, who accomplished a great deal for the benefit of the American people, and they turned against him. And they be 82 years old. Well, as far as I'm concerned, he's just a kid. He was just starting high school when I was graduating, going to college. Just a kid. And they turned him out. And I think that the people do not deal with reality, and being members of cults, they can't deal with reality, and so they don't. And that means death for the rest of us.
Which is one of Lifton's 8 criteria when he talks about the dispensing of existence and, kind of like only a certain amount of people's right to existence. And his research was all based on prisoners of war from the Korean War, talking about indoctrination of China and all sorts of things that people associate with the past, but are still very much relevant in today's age. But what do you currently foresee with the political and social climate the way that it is kind of post-election results? What do you foresee for the future of abortion rights in America and the world?
Well, I don't know. I think that abortion will remain legal in Colorado, I think, for a long time, but I don't know how long. And I think that clearly the people who oppose this are working to get control of all aspects of government. And Trump has said that he's going to shred the Constitution. So, one of my answers, and that's what he's going to do. And so can we look for constitutional remedies? Not with this Supreme Court and not with Trump in charge. Because if we say that we need to have a U.S. constitutional amendment that protects a woman's right to access to safe medical care, it's meaningless if Trump puts a torch to the piece of paper that he regards it only as a piece of paper of no consequence. He does not believe in the Constitution. The Republicans are opposed to democracy. They are opposed to the U.S. Constitution. They're opposed to civil rights. They're opposed to representative government, and they're opposed to any kind of free will, free speech. Trump is against free speech. He calls the press the enemy of the people. I mean, this is what dictators do, and that's what he is. That's what we have. I think that it will be a long struggle, but I think that the fascists will win. They're winning.
No,
They're winning. This is not a matter of the future or possibility. They've won.
no,
They've won. They've
that's
taken over the
true.
American government, and they will continue to destroy all American institutions.
Until when? I mean, does it rest in the hands of the people then? At some
Right?
point when,
I think climate change will finish us off before then. We're headed for the cliff, and Trump has his foot on the accelerator with the other Republicans.
oh my gosh,
So I
that
think,
fills me with so much existential dread.
well, that's where we are. I think that right without Trump and the Republicans, we have been headed for the cliff for a long time. I have a book that was published by also Routledge 2 years ago called Homo Ecophagous, a deep diagnosis to save the earth, which is about the climate crisis that we have created as human beings. And my Homo Ecophagous is my new name for the human species. It means the man who devours the ecosystem. Okay? That's what we are. And the human species have become a malignant process on the planet in every respect. And so that's what I describe in the book. Our current scientific name is Homo sapiens sapiens, which means wise man, not on the contrary, au contraire. And so we are in the process of exterminating all other species. We're in the process of converting all plant, animal, organic, and inorganic material into human biomass or adaptive adjuncts. That's what we're doing. And one of the things, in order to avoid that ultimate fate, is to help everyone control their fertility the way they wish. And the Republicans have just taken away the option and the freedom to control their fertility from all American women. And so, and they're also, they're one of the reasons that they're supporting Trump is so they can remove all the protections of the environment that have been set up in the last 100 years.
During my pregnancies, my two pregnancies that went full term and resulted in two beautiful children.
One, good for you. Congratulations.
Thank you. I had a condition called hyperemesis gravidarum, and I actually thought that I was going to die. And I know of other people that did not go full term with their pregnancies because they were so sick with this condition that they... Just to think about women that are suffering from that condition without being able to access medical support. And that's kind of, it's just horrible. I was on a whole load of tablets, on a drip in hospital at least once a week. It's unthinkable. And that's just, I don't want to say it's just a case of extreme sickness, but I mean, in comparison to some of the conditions.
A woman was being brought to me by airplane from Rapid City, South Dakota, with this condition, who had other medical problems, almost died in flight, getting to my help while I could end her pregnancy.
It makes my heart feel so sad and heavy to think about all of these women. And that's without thinking about all of the other human rights and civil rights that are being questioned and up for grabs at the moment. It's a lot.
They're being eliminated. They're not being questioned, they're being eliminated. That's the Republican agenda. Slavery was far too liberal for these people.
Gosh. I don't know what I'm going to do after our conversation, Warren. I'm feeling so stressed. I don't know what I'm going to do. I need to do something.
Go visit your, they say, spend the time with your kids.
Yeah, I think I'm going to have to bask in some joy and love because it's really scary. And I've been thinking very much about my friends and loved ones over in America and just watching the news closely over here in the UK, because there are one or two politicians that would happily follow in, the Republicans' footsteps in terms of outlawing abortion rights, and that is a terrifying prospect. My partner said that America is a young country, and they seem to be repeating history from other countries that's history happened hundreds of years ago.
Not for reason. We're now imitating Ceausescu in Romania and Hitler in Germany. The difference between Trump and Hitler is that Trump has orange hair instead of a black mustache.
With your recently published book, Abortion in the Age of Unreason, what is the most important message you think that is in your book that you hope people take away from reading that new publication?
Well, I think that the most important message is that safe abortion, is a fundamental and essential component of women's health care, and that women are entitled to the best medical care for their pregnancy or for their life, regardless of what they want to do about the pregnancy. That the determining factor of what the treatment should be is their desire to have a baby or not. And if they don't, they have to have access to safe abortion services. And if they want to have a baby, they should have the best medical care possible to make sure they survive and they have a healthy baby. It's very basic that the Republicans and other tyrants need to stop using the abortion issue to get power, and they need to reverse what they've been doing. It's not likely they will. And that having an abortion is a political act. Performing abortion is now a political act against the people who want to make having an abortion a political crime against the state.
And it's typically men too. I mean, they can't get pregnant, so I don't know why.
It's unequal. It's an unequal situation. It's unfair and it's unjust. And I think that there are a lot of people okay with that.
You are an 86-year-old white man working in America, and there's this big conversation around how it's the older generation of white men who are like anti-women. And you're here talking to me, having this conversation very much pro-women, women's rights and women's access to healthcare and abortions and reproductive rights. So how is it that your kind of generation of people have been tarred with this brush? Are you just kind of one person that is different, or is it a misconception of how men are supporting women?
Okay. I don't know what to tell the new doctors, okay? I encourage them. And that's all I can do. I mean, everybody's aware of this reality, and it's horrifying. And I think that basically the way we're going and having a fascist theocracy, health care for women will simply be roadkill and collateral damage on the way to a complete fascist state. And that's the plan. Women will die, and it doesn't matter. Women are there to have as many babies as possible to support the fascist state. That's the plan. That's like Ceausescu. We were talking about Ceausescu in Romania in the 60s and 70s. We're talking about Hitler 90 years ago. That's what we're talking about. Trump is talking about rounding up tens of millions of people and exporting it to where, at what cost? It's another version of the Holocaust. Go ahead.
We need to end on something that has some hope, at least something hopeful in for my mind. So you have a practice in Boulder, Colorado, that people can access. That is hopeful to me. Well, there's still somewhere people can go.
The way things are going, I'd say we have a better chance of persisting in doing this for a long time in Colorado than just about anywhere else in the country, except perhaps California. But I don't know. I mean, I think that we've seen some catastrophic changes that are supported by the American people. They just voted to have a fascist dictatorship in the United States. And Trump has unlimited power. The Supreme Court immunized him against any criminal prosecution. That means he has more power than a king. He is not subject to a parliament. He'll disband the Congress. He says he's going to tear up the Constitution. We have a one-person dictatorship surrounded by his fascist theocratic acolytes. And, he's told the Christian, you're going to be really powerful. He's right. He's handed the Christian total power over running this country. Now, if you can find some hope in that, good luck.
You were going to address women that are in need of accessing abortions. What would you tell them if they were in states where it's illegal?
They have to leave. They have to move out of the state. They should leave the states where abortion is illegal, period. And they should go, they should go live someplace else. And that's the truth with the doctors. For anybody with a brain, anybody that wants to think, wants to have free speech, needs to leave the states where abortion is illegal, because that's the next thing. In Florida, Ron DeSantis made free speech illegal, Black history illegal, sociology illegal. I mean, Ron DeSantis is a tinier version of Donald Trump. And they're all over the country. And they have weapons. They have military.
I imagine that all of these topics and threads are all pulled together in Abortion in the Age of Unreason. You kind of woven all of this stuff together.
I think that, that is true. I mean, I covered the history of this for 60 years in my book. From the time I was a medical student, learning about how dangerous pregnancy was for women and how many women were dying of illegal abortion. And all through the process of abortion becoming legal in the United States and Colorado, and also learning about the public health aspects of abortion. That's my specialty, public health epidemiology. And then being asked to help do this work, which I did, which I've now done for over 50 years, which I think is incredibly important, and it's vitally important for women. And I will keep doing it as long as I can. And even if I'm not performing the abortion myself, I'll have other physicians that I've trained who will do it with my protocol and my procedures, my instruments that I've designed, and we'll do that as long as we can until somebody shows up with a machine gun and tells me I can't. And they might have to walk out of here with, I don't want to go into my speculation about that, but I think that that's where we are with this, and I think that the Trump will turn the kind of his acolytes and his sycophants, they will turn this into a police state, and that's already happening. It's already happened in Texas, where they have people who will get rewarded for informing about people that I knew who've had to women to get an abortion. It's a police state mentality, and that's the Christian way. We're going to watch you. And so Christianity is the main cult that's affecting the United States. In my book, I said, and I remember the page now, but it says that, we're the American people are now at the mercy of an authoritarian, delusional system called Christianity that operates the fascist Republican Party that is led by an incoherent demagogue with orange hair instead of a black mustache. That's a quote from my book. That's what we have.
I just wanted to say it's been an absolute honor to have this conversation with you today.
Thank you.
I am really in awe of the career that you've had and the work that you continue to do despite all of the difficulties and the immense pressure that you're under, and how you are such a strong advocate for women's rights and for women's reproductive rights when so many people are not allies to that cause, especially at the moment. And it's a very scary climate. I appreciate and respect you so much. And thank you so much for your time today. I'll make sure I put links to your new publication in the episode description so that listeners could go out and grab themselves a copy.
Yeah, if we use the Routledge webpage, okay?
I'll put that link in the episode description. And thank you so much for your time today, Dr. Hern, and for everything that you do to support and protect women.
Thank you, Casey, and thank you for your patience with this internet problem I have here, okay?
Take care, Dr. Hern, and enjoy the rest of your day.
Hey, wonderful. Best to you. Bye.
Thank you. Bye.
And bye now.